Hello and welcome dear viewers to the another topic on dissolution testing requirements and the best practices. So in this video we will see what are the essential requirements of dissolution testing method development, what are the regulatory requirements, and what are the best practices to have a robust dissolution method and to avoid the regulatory queries. Many of the time many products receive the regulatory queries regarding the dissolution testing, and once these queries are received, the applicant has to respond to the queries so that the product can get approved. If the dissolution testing requirements are not met, then the queries will be very difficult to handle. So we should understand what are the requirements and what are the best practices. So we will start with the solubility of the drug substance. Whenever the product is being developed, that time once the API is received, the solubility data for the drug substance is required to be generated. Mainly the saturation solubility is tested in the different medias with and without surfactant and at the different surfactant levels. So this saturation solubility of the drug substance will help you to find out the sink conditions and also the requirement of the surfactant for the dissolution testing. So if the API is soluble, that is BCS class 1 or 3, that time the surfactants are generally not required. If the drug substance is insoluble and if it is belonging to BCS class 2 and 4, that time surfactant is required many of the times. So solubility data for the drug substance is required to be generated. Solubility data of the drug substance used in the drug product in the physiological pH range. This solubility study should involve the medias with pH in the physiological pH range. Description of the dissolution method parameters is required. Detailed description of the dissolution method being proposed for the evaluation of the product and the development parameters are to be included into the dissolution method development report. This section involves the justification and scientific understanding about the product and the dissolution method parameters applicable. Like for IR formulations, generally USP 1 is used, 2 is used, 3 and apparatus 4 is used. Out of this, USP apparatus 2 paddle apparatus is used mostly, and whenever there are the problems with the sink conditions or for the IR formulations with profile more than 3-4 hours, that times the USP apparatus 3 and 4 are utilized. Then in vitro testing dissolution medium should be in the physiological pH range. For the dissolution medium, 0.1 normal SCL buffers in the physiological pH range can be used. Also, purified water is also used as a dissolution medium. Then rotation speed. Generally for basket apparatus 100 rpm is used, and for paddle apparatus generally 50 rpm is used. But if the coning issue is there or dissolution is not complete with 50 rpm, that time the applicant may go up to 60 or 75 rpm. But once you increase the rpm, that rpm or speed can decrease the discriminatory ability. So lowering the paddle speed for better discriminating ability can be done. Like if we are using a USP apparatus 2 paddle apparatus at 75 rpm, so instead of 75 rpm, the dissolution can be or should be tested at 60 rpm to test whether there is any discriminatory discriminatory power loss or gain with lower speed, or using any other compendia apparatus as per the USP chapter 711. Then coming to the medium pH. So medium pH, it should be in the physiological pH range, and if it is not, then it is required to be justified and data to be submitted. Then the sink conditions. So based on the API solubility, the volume required is to dissolve 3 times of the dose, that is known as sink condition. And sink condition is generally not the mandatory thing, but it is a recommended condition. So if the applicant is not able to achieve the sink conditions, that time more justification is required to be given. Then levels of surfactant. If the dissolution cannot be proceed with the medium without surfactant, that time surfactant are required in the dissolution medium, and surfactants are evaluated. So once you select the surfactant which is suitable for the method and the product, then levels of surfactants are required to be tested. So dissolution testing at different level of the surfactant or lower level of the surfactants like 0.1%, 0.2 and 0.3% and so on can be done to determine the optimal dissolution method which can demonstrate the discriminatory ability and also provide a complete dissolution of the drug substance. So the level of the surfactant at which the applicant is getting the discriminatory power and also the complete release is required to be taken further, and it should be the lower possible surfactant level. Then the supportive validation data for the dissolution method. What is the validation data required to support the dissolution method? That is method robustness, specificity, precision, accuracy, linearity, range, stability. So these are the supportive validation data or parameters. For general recommendation on the dissolution validation, refer to the USP chapters. The dissolution procedure, that gives the understanding of the development and validation for the dissolution method. Then coming to the data supporting the discriminatory ability. The data supporting the discriminating ability of the selected dissolution method is required to be described, and the parameters are required to be studied. In general, these are required to ensure that the testing conducted to demonstrate the discriminatory ability of the selected dissolution method compares the dissolution profiles of the reference, that means the target if the product is generic, and the drug product and the test product that are intentionally manufactured with the meaningful variations in the most relevant CBAs. So these critical bioavailability attributes are the CBAs. These are the formulation or process attributes which are expected to be having a critical role on the bioavailability. So the formulation or process attributes, those are expected to critically impact the bioavailability of the drug. That factor is called as the critical bioavailability attribute. So these CBAs may have impact on the absorption rate and the extent. These may be the drug substance polymorphic form, these may be the particle size of drug substance or polymer level or tablet hardness and any other critical material attribute, critical process attribute or storage condition. So whichever is having a great impact on the bioavailability parameter of the formulation, these are called as CBAs. So these CBAs are required to be understood, and their impact is required to be studied onto the formulation and the dissolution discriminating ability. Then dissolution profile data and similarity testing. So submit the dissolution profile data and similarity testing results obtained with appropriate statistical test. That may be F2 values, that may be bootstrapping, or that may be MSD method, comparing the test and the reference product. In addition, if available, submit the data showing that the selected dissolution method can reject the product that is not bioequivalent to the reference or target drug product. Supportive dissolution data may also be submitted showing that the selected dissolution method can detect the change or changes into the drug product occurring during the accelerated and the stress conditions. So the applicant can use the accelerated sample or stress condition samples, and test is for dissolution testing, and if possible or if there is any change, then the applicant can prove the discriminatory ability of the dissolution testing. Then also provide information or data showing that the proposed dissolution testing methodology and the proposed acceptance criteria can reject the batches with inadequate amount or type of the polymorphic form or PSD or any other CPA. So this is also a part of the dissolution profile data and similarity testing, along with the ability of the dissolution method to detect the bioequivalent and the inequivalent batches. Then the drug substance polymorphic form as a CBA. If we consider a drug substance is a polymorphic form A or B or mixture, and it may get converted to the another form, or the drug substance is amorphous, or it may get to crystalline form, or it is a crystalline form and may get to the amorphous form. So that time the different dissolution profiles are required to be generated and studied with the crystalline content or amorphous content, and that data is required to be submitted. Then complete dissolution point multi-point profile data for each variable tested during method development, assessment of the discriminatory ability and the validation. So generally number of unit tested should be 12 units. Their mean, standard deviation and percent CV at each time point should be given to the authority with the mean profiles. That means the applicant should submit the mean and individual values of 12 units along with standard deviation, relative standard deviation and the CV. Then report the dissolution data as the cumulative percentage of the drug dissolved. The drug dissolved is to be taken as a percentage from the percentages based on from the percentage of the label claim. That means if the drug substance is with dose of 200 mg tablet, and if the drug is released 100 mg in 15 minutes, so it will become 50% of the label claim. Then detailed information of the tested batches of the drug product using proposed dissolution method. So whatever the drug dissolution method is proposed by the applicant, so all the data should include the batch number, lot number, manufacturing date, manufacturing site, testing date, batch size and the dissolution testing protocol, and also the protocols with the effective dates. So this is the generalized requirement. Then acceptance criteria. So acceptance criteria should be very judicious. It should not be much permissive, and this acceptance criteria should be able to reject the batches with inadequate bioequivalence. So based on the submitted dissolution data, the proposed acceptance criteria should be not less than 80% Q in 15 minutes, 30 minutes or 45 minutes. This is just an example which should not be permissive and therefore acceptable for the drug product at the release and on the stability. So these criteria should be very judicious. This criteria is to be in line to the current regulatory guidelines, and also this acceptance criteria should be in line to the bioequivalence batches. For example, if you are getting 90% dissolution at 15 minutes, and if the applicant is giving not less than 80% at 45 minutes, then it will not be acceptable as it will become more permissive. So at that time the dissolution acceptance criteria should be not less than 80% Q in 15 minutes. Dissolution method should describe the dissolution parameters in detail like USP2, paddle apparatus, 50 rpm, 900 ml of phosphate buffer with pH 6.8 with 0.3% SLS at 37 degrees Celsius plus minus 0.5 degrees Celsius. And the acceptance criteria will be, for example, 80% in 15 minutes or 80% in 30 minutes or 45 minutes, whichever is applicable and suitable as per the bioequivalence batches. Then exhibit batches dissolution data. Whenever the exhibit batches are manufactured, these are tested for multimedia dissolution and also for the profiling in the QC media. These exhibit batches are required to meet the dissolution specification in the stability until the expiry period. If dissolution failures are observed on stability, this should be described. If one of the batch is failing into the dissolution, these are required to be documented. Any corrective action to avoid such dissolution failure should be discussed, and a new batch should be manufactured to demonstrate correction of the issues if needed, and is required to be submitted with the correct information to the regulatory authority. Then in summary, we will see the requirements and the best practices so that the regulatory queries can be reduced and avoided. So consider all the regulatory guidelines for testing condition and specification, and if possible, consider the acceptance criteria which can be accepted globally. If the product is for global market and if you want to extend it for the other markets as well, then the global specifications can be derived. Then discriminatory power of the dissolution method and the discriminatory specification should be there. Method should not be under discriminatory or over discriminatory. Then the specification should be clinically relevant, and this should be based on the understanding of the formulation, manufacturing process, stability, and the drug substance solubility. Then standard dissolution testing conditions should be used. The dissolution testing conditions should be mild. Mild condition means, for example, if the USP apparatus paddle is used, USP apparatus 2 paddle is used, that time 50 RPM or 75 RPM or 60 RPM can be considered as mild condition, and 100 RPM of the pedal can be considered as a worst case, or which cannot be accepted. It will not be considered as a mild condition, as 100 RPM is not accepted generally for the oral formulations with paddle apparatus. That time justification is required to be given, or other apparatus can be tried. Then evidence based justification for use of non-standard dissolution testing conditions like 100 RPM with paddle apparatus, or peak vessel, or 2 liter of the dissolution method. Generally up to 1000 ml dissolution method can be used. If more than that is used, that should be justified, and justification should be based on the evidences and the scientific data. Then justification for the use of peak vessels. If you are going with the peak vessels, then we have to justify. Justification for the use of sinkers, holders, and the baskets for the dissolution. Sometimes the sinkers are used, sometimes the tablet holders are used, sometimes other uh, auxiliaries are used for dissolution testing for some of the ER products or the other products which are uh, having some modification or technology for the solubility enhancement. That time these justifications are required. So this is regarding the requirements and the best practices for dissolution testing. I hope you might have got a good understanding from this video. Keep watching Pharma Learning in Depth channel videos. Please do like, share and subscribe to this channel and share with your friends. Also, please comment uh, on the videos so that I can understand whether the viewers are understanding these topics or not. So thanks for watching this video, and stay tuned to Pharma Learning in-depth channel.